All right, this morning the Gauteng Health Department is calling on retired health workers to assist with the COVID-19 pandemic. The department says it wants to ensure it has enough capacity to deal with the anticipated rise in infections. Gauteng's Health MEC, Dr. Bandile Masuku, joins us now via Skype. MEC, good morning to you and welcome. Now, we know well that Gauteng is the epicenter, the Premier of the province calling it the battleground in South Africa. Before we get to the retired health workers, day one as far as response is concerned here in Gauteng, are you satisfied?
Good morning and good morning to your viewers. I'm not quite satisfied with how the citizenry of Gauteng behaved yesterday, but there are a number of factors that were actually alluded to, but I think the movements were quite many. You know, it was not a lockdown, and hopefully with the enforcement of the regulations, we'll see much better improvement on day two. But the important thing that we need to carry out as a message is that the citizens must understand the importance of the lockdown, because it's all about slowing down the rate of transmission amongst the communities. And if we don't respect the regulations, we're going to have a big problem.
So in your opinion then, is it stronger, more robust enforcement, or do the authorities need to change the messaging that they're putting out?
I think it's both. We should do both. We should have a firmer enforcement part of it, and also try to work on the public education. It's something that we need to strengthen up generally across all other time, even outside the outbreak, outside the pandemic. You know, we need to carry a very strong messaging about prevention, because some of the, if not all, of the disease burden that we see in our facilities are all preventable, and they just need us to work together and to increase our level of understanding on how to prevent them.
Let's talk about the facilities then, if we can. How big a problem, in your opinion, on day two is lack of medical capacity in the province? I think I'm correct in saying that you were aiming to add 2,000 hospital beds for quarantine and isolation by Friday, for instance. Was that target, or is that target achieved?
We have achieved it, and we have went beyond, particularly for the out-of-hospital actual management of patients. That we have achieved. So now we are steadily looking at the issue of hospital treatment, and mainly we are looking at creating capacity at the level of ICU and high care, which mostly patients who come to hospital, who are hospitalized, will need that particular care.
Which leads us on to the appeal that you are making this morning in the province about calling on retired health workers to come forward. What specifically are you asking for today?
We are looking at people who are going to add an extra hand in our next phase of containment, in terms of what we call tracing of contacts, contacts being those individuals who have been exposed to the infection, or somebody who has been infected, because that's where we can win the battle if we're able to strengthen that capacity of tracing the patient, of tracing the contacts, and making sure that those who we found and they cannot self-isolate, we're able to remove them from those communities for their protection and the protection of the community. So we are getting into a next gear of the containment, which will want us to strengthen, and we need a lot of people, because when you do the swab testing, of the like the nasopharyngeal swab, is quite uncomfortable and it needs a particular skill.
So this would mainly be retired nurses that you're looking for?
No, we want to increase capacity throughout. I think we have been saying as Gauteng that we are taking this as a good advantage to fast track most of the things that we thought we'll do over a period of 3 to 5 years, but we can fast track some of them. And one of them is just to make sure that we don't have vacancies in our facilities. And we have declared war before on the vacancies. So now this is a call also on those who are post-com service and also who are sitting around and unemployed, because we've had the stories of unemployed healthcare workers. So what I will also say, maybe just to correct something, Jeremy, that the call is not only for nurses in terms of the advert. It's for everyone, all levels of categories of healthcare workers, including occupational health therapists, environmental health therapists, and all the levels. And I think it's important to actually make sure that we do that proper announcement.
What you're also suggesting is that if the volunteers don't come forward in their numbers, we could be in trouble down the line as the viruses start to reach the apex.
Yeah, I think we will see. There's a number of strategies that can be put into place. We have always seen the issue of task shifting, and also developing new cohorts of health workers. Your community healthcare workers are one cohort that we want to use effectively. Clinical associates is one cohort of healthcare workers that we want to use effectively. So we'll just have to see how we continuously create the capacity as we actually, respond. But the important thing is, beyond the pandemic, we are building the capacity beyond the pandemic for us to respond effectively. But beyond, when we look back, we must say that the capacity we have now is far better than when we started the pandemic. So we take it as a good opportunity.
Well, that is really good news. Dr. Masuku, aside from the staffing quotient that you've just referred to, and again, I know it's early days, but where, in your opinion, would be the weak points in provincial capacity, given that we have huge numbers of urban poor and also, allied to that, a food security problem?
I think the food security problem is one of the major ones, and I think we've been with the acting MEC Fanyaza Sufi, we've been putting up some measures, and we're quite pleased with the response from the corporate South Africa and all different organizations who have made lavish donations, and we are hoping that it will continue so that we continue to strengthen the issue of food security. But the second part is just we've got densely populated settlements. And, when we have to contain the spread and slow down the transmission, it means there are many people that would have to remove from those communities to protect them. Particularly those who are positive contacts, we have to remove them from there so that we are able to protect those communities. Even the testing sites that we are going to be putting up, they will be mainly located in those densely populated areas to make sure that when we get a positive contact, we are able to quickly track them and trace them, and also the people around there be able to be tested immediately.
Just a final question to you. Are you concerned at this point about the supply of water, particularly into informal settlements? I'm reading this morning that it has now become a real problem in parts of the Eastern Cape.
We have a big problem, in Tshwane, you would know, the Hammanskraal area and the Bronkhorstspruit area, and that's where we have to do something better. And with the working with the municipalities, we'd be able to try to do it. The Department of Water and Sanitation National, they've been able to come on board to assist us in providing of water tanks and everything. And also in that regard, there are some organizations, companies who have made like generous donations of JoJo tanks and all that, which will come in very handy actually moving forward. And we are quite pleased. The issue is that the response and the plan might not be enough, but I think the ability of escalating it and making it adapt and be dynamic to respond, that's what is important for us.
I appreciate the update. Thank you very much indeed, Doctor, and you and your family stay safe.